Hello, good evening. My name is Felix Chavez, and I'll be playing the role as the counselor in this session. This is my follow-up session with Nancy. Nancy, I want to say thank you for coming back. I appreciate you coming back to see me. And I wanted to give kind of a rundown of what we can expect today, and you let me know feedback concerning if you feel okay proceeding.
Sure.
So first of all, again, welcome back. The purpose of this is we're going to begin conceptualizing an assessment report. So what is an assessment report and how does it work in our alliance? So an assessment report is going to help both of us kind of have, again, another tool similar to the assessments we did in the initial meeting, kind of seeing how we can piece together parts of your life and how they are contributing or affecting kind of your presenting symptoms. And we'll get all into that later as far as going down the list and what those mean. After that, we'll kind of go over it together, seeing where we're standing. And then because I got a good deal of information in our first assessment, this will kind of just act as gauging where we're going to begin proceeding in our treatment goals together.
Okay.
So first and foremost, we're going to go over some client demographic information. And to my understanding, you were in active duty for quite some time in your life as an Army chaplain, and you recently switched to reserves, and you also recently just had a move to Nevada. Is that correct?
Correct.
All right, good deal. And just so we can catch up, how has your job been going since the last time we spoke?
Um, in general, it's been good. I had a few on the job training kind of issues, but we got it worked out. I think so far at this point, everything's going fairly well. As far as my reserve, I am in the process of trying to move units here on the West Coast. I'll be moving my husband in a few weeks, and I won't have a need to go back to Columbia for on a regular basis. So it doesn't make sense to keep myself so spread out because it is very difficult.
Okay.
Mhm.
So we're looking at, again, kind of making another transition.
Yeah, and knowing that, and
Mm-hmm.
I've been in transition for about 15 to 18 months now. Actually, it feels longer than that. A consistent transition.
Mm-hmm.
Um, that goes back to the summer of 2015. So honestly, um, is that yeah? Honestly, I've been in transition for 3 years straight, over 3 years straight. So, um, and it's been hard. It's been very very hard, and my yeah, I would say it's probably a lot of why I'm here. So
All right.
consequences of it.
Good deal. Good deal. So after this next transition, do we see ourselves being at that spot for a longer amount of time than we've been in Nevada?
I hope so.
Okay.
You mean to be here in Nevada for a while? I
Mm-hmm.
hope so.
Okay.
This is 1, 2, 3, 4. This is my fifth place in 3 years, and I'm about to move again. So I hope so. Even like looking for another place to live, there was one place that they were just wanting someone for 6 months. I was like, no, this isn't the place. I want someone. I want a place that I think I can stay, you know, for at least 2 years, if not longer.
Good deal. Good
So
deal.
yeah.
Last time we didn't have a chance to review, and I would like to for the report, kind of your education history, maybe alongside all your Army history, maybe high school, college. Could you expand on that for me?
You mean where I went and the
Correct. And
degrees,
maybe
or
like your
is that what you're
study.
looking for?
Correct.
Okay. Do you just want the like you want the place, or you want just the name of the school, or you want to know where where the
Tell me
location?
where you graduated from, which high school.
Okay.
And
Was Conway High School my hometown?
okay.
Yes. And sorry, I have a talking lamp. Um, yeah, at Conway High School. I graduated in '84, and then I went to Winthrop College in Rock Hill, South Carolina, near Charlotte, North Carolina.
Okay.
I was there for 4 years. I graduated on time with a bachelor's in mass communications, a minor in theater, and I took a short break in education. So I graduated in '88, and I started seminary to be a minister in fall of 91, and was in that program for 3.5 years. It was a 3-year program. Also, right before I went to seminary, I gave birth to my daughter. So I was a single parent, going to school full time. And so I graduated. I had to do a class. It's a 3-year program. It took me a little longer because I had to do one more class that I didn't get to. So actually graduated, officially graduated in May of 1995. Took a call to ministry in fall of 1997. So finally got into that profession, improved in everything. And then I was at first, I didn't tell you. I was at United Theological Seminary of the Twin Cities. There's 2 different ones. They're not related. So it's UTS of the Twin Cities. That's in St. Paul, Minnesota. And then my first call was in the Boston metro area. I was there for 4 years as an associate pastor. And then I moved back to the Twin Cities and took a call as a sole pastor for 6.5 years in South St. Paul, Minnesota. And then left there and went into the military. So June of 2008, I was in the military, and then had an opportunity to do what we call clinical ministry, clinical pastoral education. And that was in San Antonio in an Army hospital there. That was a year-long program, but it also included, with the Army, they had contracted all the CPE students to get their Doctor of Ministry degree, and they were contracted with Erskine Theological Seminary in Due West, South Carolina. So we were doing both things at the same time. Got a lot of credit, for our our professional experience in the military. So I only had to take 5 classes, and then do the dissertation. So I had some delays, and I had to deploy, and I had some delays in all of that. And I finally graduated from Erskine Seminary in May of 2016. And I was deployed at the time, came home for that. Then after deployment, I moved up to Leavenworth, where I found out I was being discharged out of active duty due to 2-time non-select to major. So I went back to Columbia after that in June of 2018. And during the time of unemployment, I started this program, the clinical mental health counseling program with Antioch.
Yes.
So
Turn on.
I think that's all my formal education. So
Good deal. So very tenacious, completing mostly everything you started.
yeah, I have. Well, yeah. Sometimes it takes me a little longer, but I get there. Yeah.
Good deal. Thank you for that. Let's move on next to maybe medical history. And let's just ask simply, um, do you keep up with maybe yearly checkups, whatnot, what have you?
I used not to
Hmm.
because I couldn't afford to.
Hmm.
Um, and I grew up not going to the doctor very much. I was always healthy. I mean, if I was sick, really sick, I would be taken to the doctor, but, flu or, I just had minor things. Um, but as far as regular, like a wellness check, um, I haven't been doing that since that started when I came in the military because it's required. I have a health check at minimum of once a year,
Hmm.
dental twice a year. If they catch something, then they fix it. And it was somewhat, I guess you could say, free healthcare. But um, and now that I'm in the Army Reserve and I'm also work for the VA, there are certain requirements to keep up on certain shots and things like that. So like I get tested for TB, I get tested for HIV regularly. Um, I don't remember the schedules. Immunizations, I have a flu shot every week, every year. Flu shot or flu mist, whichever. I did that already. And then what's come up on my medical right now is um, tetanus shot. So a 10-year tetanus shot. So other than that, I think I'm pretty good. I had my overall checkup back in April, so I'll have to do that again in April, something around there. But
Okay.
I've got some medical issues. They're under control relatively. Getting out of the army and getting away from um, the the medical system, I'm having to start with all new doctors.
Hmm.
So that's really frustrating right now. It's a very long process for whatever reason. And I feel like I have to prove that I have the problem because I don't present the problem because I'm being treated for
Hmm.
it. And because the treatment works and the problem is resolved, but I have to stay on medication, I don't get believed. And so I got an issue there right now. But in general, I'm fine.
Okay. So historically, just common sickness and our job has helped us in keeping up to date with checkups and flu shots and whatnot.
I've had surgeries. I don't know. I know lots of times I get asked that question about surgeries. I don't know if you want to know them, but I've had, some significant surgeries along the way. Um, so let me know if you need that information.
How has the healing processes been from those surgeries? Have we healed from the procedures well and correctly, would you say?
Yeah, um, I've re-injured my shoulder since the surgery, and there's really not much that can be done. So that I know of. Um, so, but the initial surgery, yeah, I healed fine.
They're not no longer impacting us, would you say? Maybe um, they were corrective or they helped overall, the surgeries, would you say?
They were helpful or corrective. I do have chronic pain at this point, but um, the last medical procedure I had was on my neck and it didn't last very long, but it's not expected to be a cure or a complete fix. Um, it didn't appear to last as long as I had hoped with some nerve issues and muscles. So, but yeah, I guess to answer your question, I heal fine when
Okay.
I have those. I have always been one to do what the doctors tell me to the best of my ability. So I usually heal pretty well.
Alrighty. moving right along to substance abuse history, I know we took the Michigan alcohol assessment the last time we met, and there was no results that were alarming. We did also talk about medication that you were taking. Could you just quickly list for me what medications you're taking for your mental health?
I'm only taking Wellbutrin.
Okay, good deal. And then last time you mentioned you had taken Ativan previously, correct?
Yeah, I was prescribed it,
Okay,
and I have not taken Ativan since 2012.
okay. So currently just Wellbutrin. All right. So last time we talked about a wide array of concepts. I want to touch base on some things briefly before we kind of start looking at how I can construct the assessment report, and maybe the next time we can get together and collaboratively review it. One thing I remember was we talked about emotional needs and how they were and were not being met. Can you tell me presently about your emotional needs and if they are being met or not?
You're probably going to have to get specific. I don't know how to answer the question.
Okay. Specifically, you talked about your daughter and wanting, to spend more time with your daughter, increase kind of that relationship that you may have felt was taken away from all your endeavors. Is that correct?
Yeah, that sounds like something I would have said.
Okay, good deal.
Yeah, I'm sorry, I just don't remember the conversation, so you'll have to remind me.
Oh, no worries at all. How is your relationship with her today?
My relationship with her is great. We talk a lot. It seems that she continues to improve her mental health, even though, lately it finally admitted she would benefit from counseling, and I agreed with her. And so she seems to be increasingly happier, and Courtney hasn't been happy in a decade at least, so that's a positive thing. So it lessens the stress and worry off of me. I've had to come to some acceptance that she may not move to Reno after she graduates from college in May. But ultimately, I just want her to be happy. And, if she can move a little closer, that would be great. But if not, ultimately, it's more important to me for her to be happy where she is versus be near me. But she has to figure out really what that means for her. And I think that part of it is to be nearer to me at least. We talk about being in the same city. I think that would be helpful for both of us. But ultimately, she needs the next move that she makes is not going to be the one that I had influence on. I really want her to make her own decision. And if she's unhappy, then she has to deal with the fact that she decided, and that there were no real influencers or any sense of obligation or requirement, because she's where she is because of my mom being ill, and we asked her to move, and that's been very hard for her. And she moved in 2015, so it's been almost 3 years. And my mom died, so it's been very difficult, and she needs to move out of that area. It doesn't really meet a lot of her needs. The only reason that she stays there is she's trying to finish college, and finish a promise to my mom, which is all intertwined, of course.
Mm-hmm.
Yeah.
So could you tell me kind of maybe what you would like to get out of um, our next few sessions in therapy? What kind of goals would you like for us to establish?
I get asked this all the time, and I don't do a very good job of figuring that part out. Um, I'm thinking.
Yes.
The one thing, this would probably be a long-term goal. And there may be other goals that either short or long-term that get to it. But I think in the therapy that I've had in the last, since 2011, so the last 7 years, I've come to understand that the trauma that I have experienced as a very small child and throughout my life, the way I see the world is very different than most. I really connect with people that have experienced trauma because I think maybe we have a little more in common as far as how we see the world. But for those that have not had some real difficulty in life, I don't relate to. And I just thought that they were always the abnormal person. And I had my second therapist really helped me understand that even though my family appeared to be very normal, as I compare it to other families, it really wasn't. Most likely, I have quite a few sociopaths in my family that had some huge impact on my mother and indirectly and directly to me, hence some of the trauma. And so I don't get things sometimes. I like people tell me I work so hard, but I don't think that I do. It doesn't. My level of stress, my level of what society would consider normal as working hard is just really drastically different. And it affects how I assimilate. So, like at the VA, I struggle at the VA, not necessarily to do the job, but to assimilate with coworkers. And then, and at the Army Reserve, I'm having a lot of conflict with my supervising chaplain because I work harder than he does. And by fulfilling my responsibilities, I think I ended up publicly shaming him, which became a cultural issue, a gender issue, all kinds of stuff, religious issue. And he's come after me now for 2 months. And I have an enormous amount of anxiety about having to interact with him now. And he has lashed out publicly to me I think, to shame me back. So he's intentionally trying to shame me where I wasn't trying to shame him, but that's how he took it. So I have 3 significant events with him at this point in a matter of maybe 8 to 10 weeks where things have gotten drastically worse. And at that time I was really, really stressed. So I probably didn't react very well either because I went into survival mode, that traumatic survival mode. And the last thing you really need me to do, and it's not good for me, is when I stop caring. Because it's like some of that narcissistic, sociopathical kind of behavior that's been in my family that I, in some ways, thought was normal, that I've really tried to suppress and overcome will come out. And I need work with that. And so I don't know how to break that down. um, if you can, then you might help me figure out, the short and long-term goals for that. I will tell you one thing about the medication. You asked me specifically about psych meds, but I also have been taking Otezla since April for psoriasis. But I learned when I was prescribed that when they did the study, one person committed suicide within that study. So there is a lot of concern when people go on Otezla for psoriasis, really acute psoriasis, plaque psoriasis. I have 2 or 3 different kinds apparently. A lot of that is due to an enormous amount of stress I've been under the last, since 2011, more so than usual. So yeah, they said that people are always concerned about it, but it was only one person in the study that had committed suicide, and it was really felt that it was due to other issues, not necessarily the study. And then also learned by the dermatologist that initially when Otezla was created, she told me that it was a psych med. And it no longer is used as a psych med. So, she's like, just really be open with me. If it works, it works. If it doesn't, it doesn't. It worked beautifully for my psoriasis. And so when I went to the dermatologist here at the VA, he gave me a hard time about being on it, wanted me to do other methods of it, of my psoriasis, and then claimed, that my psoriasis was minimal. And I said, well, it's minimal because I'm on Otezla. And tried to explain to him how much I've suffered every day for over 7 years on my hands and my elbows and through other parts of my body. A lot of public embarrassment because of the way my hands looked and stuff. So, these are some of the behavioral things that I have a hard time with, is I picked up on the fact that he just really didn't believe me. And he was not very nice to me, so I started being pretty sharp with him. The nurse, it was a male nurse, but he was paramilitary. The dermatologist is not. Paramilitary guy, he knew I was ticked, and he knew I wasn't appreciating the way I was being treated. So he did try to do some intervention, and I appreciated that, and it kind of calmed me down a little bit, so I didn't lose my cool. Because then finally the dermatologist was like, well, Otezla is like the last stop kind of thing. There is other medication you could take, and will you take that? And I said no. And I'm saying no because why would I go, if Otezla is the last stop, then that means it is more effective on difficult patients than the other one. So logically, why would I go down to something when I'm taking Otezla, it's working, and I still have breakouts, but they're more manageable? Mm-hmm. It doesn't make any logical sense to me. So he said, okay, and he did. He said, I will write you a prescription for Otezla. And he did that. And he said, come back and see me in 4 months. But then when I got my medication, he had only written the prescription for 30 days, which meant that the last 90 days before I saw him again, I wouldn't have any medication. And I just saw it as passive aggressive. The pharmacist said they were going to call and try to correct him, and if he was willing to do the refills. But when I picked it up, there was no refill. So, he made his determination. So I decided to go off of Otezla. Well, I had stuff to back, to take if it got so bad I couldn't manage it emotionally anymore. And in the midst of all of that, what I learned is a lot of the irritability that I've been having, that's been increasing over time, was going away. So now I've been off of it for 3 weeks. It took about 10 days for me and my irritability to really just calm down. And then it just seems like I get more and more relaxed every day. Um, and things don't set me off the way they were. So it's possible that, and probably highly probable in my mind, that no, the Otezla did not make me suicidal, but it did make me highly agitated and irritable. So as far as the medical piece, then yeah, I've got, I think and I do have a psych appointment, psych appointment to look at medication next week, and so I could talk to her about that. But I don't know. I still gonna have this whole, in some ways, connected to psychosocial issues that I have with my psoriasis in my hands, because they're breaking out again. And so right now I'm just trying to stay calm to keep that from getting worse, because that's the culprit of it all. And it's kind of like once it starts, it's like your body can never heal from it. It will immediately break out again. So that's kind of where I'm at with that. It's a long story, but it's intertwined with the goals, I think, and the medication things that you've been asking me.
Okay, most
Does that
definitely.
make sense?
Yes, of course. Is there anything else that you would like to speak about that maybe I haven't touched on?
Nothing that really comes to mind. I'm pretty open. So as we go along, if something comes up, can we, alter the goals, or change, or completely take goals off and put others on, or add, or however we adjust, because I've gotten to where I can only just think about where I'm at right now in the moment.
Right.
And I'm not too much of an in the moment person, and that's one of my goals, is to try to be a little bit more in the moment and not be so worried about tomorrow. That if I can have that flexibility, I think that it keeps the stress down from having some expectations that I have to meet. So.
Okay. So the assessment report is going to allow us to kind of have that flexibility in seeing per session what's changed. Most simply, what's changed for each session. That'll be reflected in the assessment report, and therefore that we can apply to our treatment goals and ultimately the plan. So with that being said, thank you again for expanding on points that we didn't touch base on. So where we go from here is I would like to construct the assessment report of what we've gone over today. The next time we meet, we'll kind of just briefly go over it together, see where we're standing with all the conceptualization of what we're going through, and then start making some treatment goals and really start getting into the nitty gritty of what we can try to accomplish together.
Okay. All right. That sounds good.
So Nancy, again, thank you for sharing. Unless there's anything else you would like to add or mention at this time, the next time we do meet, we'll go over the assessment report and we'll proceed with treatment goals from there.
Okay. That sounds good to me. Thank you.
Okay, most definitely, Nancy. It was great catching up with you, and I hope you enjoy the rest of your evening. Thank you.